Stephen, a number of issues. How you reopen, when do you keep social distances, and where are you on the trials? Where do you think the priority should be now? Is it really trying to focus on medicine or go a little bit more slowly, potentially, in reopening the economies?
No, I think obviously the vaccine is incredibly important, but I don't think that's a priority right now. I think different countries and different populations have different levels of infection, and everybody needs to decide how low that they're going to try and get their level of infection before they start to ease the restrictions that are in place. So I think people are in different places. They need to look carefully at where they are and then make the best decisions about how to ease the restrictions.
But how do you make sure that there's not a second wave of infection coming?
So you have to be there are two things I think we have to transition carefully out of the lockdowns, and then we need very good monitoring in place. And it is time for people to think about exactly how soon they will detect potential increases in transmission. I think that's an important topic today.
Dr. Riley, good morning. Tom Keene in New York. You are one of the definitive experts in the world on the urban to rural transfer of viruses. I want to talk about Brazil right now, which is an absolute total viral train wreck. Explain to me the viral transfer that we will see out of the major urban areas of Brazil, and with all that rural territory, the Amazon basin, all of it. Do we have risks there of Ebola-like events or like worse virulent events because of how unique Brazil is?
I think Brazil is unique. When you look at the amount of air travel per capita there, you see the distances and the vast open spaces between their major urban areas. So I think each urban area will have been seeded and be having their independent epidemics, and then it will be propagating outwards from there. But it will be difficult at this stage, I'd imagine, to get good data and good surveillance on that. So I think we have to kind of wait and see in what develops. With no reason to expect,
Is there any history that the viruses mutate moving urban to rural? Do they change in character at all?
No, they're changing all the time. And, we're getting so many samples of this virus, we will be able to track it using those small changes. But we don't expect it to change the properties. There's lots of neutral changes, if you like, that will allow us to track it, but not necessarily, very rarely change the way that it affects people who are infected.
Will this come back every year, the coronavirus? China seems to suggest that actually we could see COVID-19, develop like the flu, that it mutates, but actually it also comes back. If it comes back, will it be with the same violence?
So, we've got to think about the reasons that it's going away. It's going away because we're changing our behavior, and we're trying to find a way to function with increased economic activity, but much less virus. If we carry on in that kind of successful way, it shouldn't come back. And then hopefully we get to the stage of a good vaccine in very high volumes. I mean, that's what we're hoping is the kind of the best path forwards. So if we accepted it and kind of allowed it to circulate, then it would become more like flu or the other seasonal coronaviruses. But the public health strategies that we're seeing around the world, they're not based around that level of kind of accepting it just circulating.
Stephen, I saw a wonderful chart. It was a per capita chart. It was a population weighted chart of everything you're looking at every day, with Johns Hopkins University having data, and also, of course, Imperial and UCL in London and the others. Tell our European audience and our United Kingdom audience what they should expect in the next 30 days, the next 60 days, in terms of the geographic transfer of this virus.
So I think right now, in Europe, there's good evidence of decreasing rates of infection. And we're seeing good evidence from the UK. Germany's at quite low levels. So I think in Europe, we should expect continuing decreases. And local patterns are being driven by local epidemics. They're not being driven by kind of international transfer to any degree at the moment. And then I think elsewhere, I think patterns in the US are less clear. The signal of sustained decrease across the different geographical units in the US is not as clear to me, to my reading of the data today. So it may be that incidence levels there are sustained over that period of time. But obviously, there's a lot of uncertainty. And it's, as we've talked about before, it's driven by how people are behaving, how they're adhering and complying with the recommended advice.